Okay, I'm here now with the next slide. We're going to see few terminologies today. Okay, this is a low power view of a biopsy of a hollow viscus, right? Okay, I'm just going to entire biopsy is abnormal. I'm just going to focus on few normal areas so that we can understand what a normal structure looks like. Then we can go to the pathology, right? I'm zooming it up, so I'm seeing an apparently normal looking area in this biopsy where I can see the epithelium and the glands, right? So the thing which I want you to appreciate is these glands are made of a single layer of epithelium, or they are lined by a single layer of epithelium. Any gland you see here, they are lined by a single layer of epithelium, right? So epithelium, below that we have glands, and this part of the biopsy between the glands is called as lamina propria. Okay, this is a biopsy of intestine. I have epithelium, I have glands, lamina propria. The layer just below that, right, this one, this pink layer, I'm zooming it out, it's made of some cells which have spindle shaped nucleus. So a spindle shaped cells with a pink color cytoplasm. This is muscle. So this layer is called as Muscularis Mucosae. It's below the mucosa and it's Muscularis Mucosae. The layer below the Muscularis Mucosae, this layer where you're predominantly seeing the lymphatics and the blood vessels, this entire layer is called as submucosal layer, right? Now I'm coming to the below layer next to the submucosal layer. What I'm seeing is again a pink layer with spindle shaped cells, muscle layer, but yeah, compared to that muscle, this is much more thicker. I call this as Muscularis Propria. The layer below the Muscularis Propria, this layer I'm going to call it the subserosal layer, and then comes my final layer of the serosa. Right? This is a normal biopsy of an intestine. How it's going to look: epithelium, lamina propria, muscularis mucosae, submucosal layer, muscularis propria, subserosal layer, and the serosa. Right? Now let's go to the pathology. Pathology is fun when you know the normal things. So now I have an intestinal biopsy where I have a lesion all around, but predominantly I'm looking at the lesion here. Right? I have a lesion here. I'm zooming it up. I'm looking at a lesion which is predominantly bluish in color, dark bluish in color. So I'm looking at a lesion, which part of the cell is blue? Exactly, the nucleus. I'm looking at a lesion which is rich in the nuclear content, or in other words, I'm looking at a lesion which is rich in the DNA content. So this is the same gland. We saw the first gland, just imagine that and this. First thing I'm looking at is I'm having more number of cells. I'm having more than one layer of cells, and the cells are a bit more dark, right? So I have a lesion which is having more number of cells, which is having more layering of cells, that is loss of polarity. The cells are a bit more dark, high NC ratio, and the cells are not the same. Look at this cell, look at this tiny little cell which is much more bigger in size and different from this tiny little cell. So I have a cell which is pleomorphic, high NC ratio because it's blue in color, loss of polarity, more than one layer of cells, and obviously I can see a cell in this tissue. I can see mitosis. I'm not sure whether you were able to appreciate mitosis here, but these are mitotic figures. So I have a lesion which has more nuclear content, right, which is more in number as well, high NC ratio, pleomorphism, mitotic figures. Exactly, you're right. This is a dysplastic lesion. I'm not calling it a neoplasia, I'm not calling it a malignancy, I'm calling it dysplasia. What makes me to call this as malignancy is the next finding which I'm going to show you. Right, we saw this as the normal mucosal layer, right? So this is the normal mucosa of this part. So having all these features, all these lesions below the mucosal layer here, I call this property as invasion. So I have a dysplastic lesion which is invasive, which makes me call it malignancy. If you notice, this is forming the same glands as my normal lesion, so I call it an intestinal adenocarcinoma. That's my diagnosis of this slide. I'm going to go into touch into two more topics: grading and staging of a tumor in the same biopsy, right? So fine, let's zoom it out once again. Even though this tissue is not normal, still I can see that this tissue is forming glands. If you appreciate, yeah, you can appreciate that they are forming glands, they are forming rounded structure, which means this tissue is closely in match with my normal epithelium which I showed you, which is the neoplasm resembles my normal epithelium or my normal structure. That's called a grading of a tumor. So I call this tumor, see, I can see both in the same view. I call this tumor a well differentiated intestinal adenocarcinoma. This is called grading. The next part is staging. right? I'm just comparing, right? This is the normal thing which we saw first: epithelium, lamina propria, muscularis mucosae, which is lost here. I am not able to see submucosa. I can't see the submucosa. And look at this muscularis propria. I can see it till here, not present, and I can see it again from here, right? I can see the muscularis propria here. I can't see it here, and I can see it again here. So I'm having an intestinal neoplasm which is gone from the epithelium deep down to the submucosa, destroying my muscularis mucosae, as well as it is destroying my muscularis propria, and still it is going down. These are also neoplastic cells, right? So I have a lesion which is started from the epithelium going till the serosal layer. So I call this depth, and I call this in the form of a classification, TNM classification. This is for the tumor invasion, and this tumor has reached close to the serosa, or T3. When it's going to the adjacent organs, which can be appreciated by radiological measures, I call it T4, right? Right, so today we saw three things. First, the normal thing, how normal intestinal layers look. And intestinal well-differentiated adenocarcinoma, we saw what is grading and staging, right? I'll come up with next time with a better video. Till then, bye-bye. Say it out loud, pink and blue makes sense.